Hey, what's up, fam? Dr. G here, and today I want to discuss 10 spices and foods in your pantry that you can start using from now to help lower inflammation. Let's get started. So, let's talk about inflammation in terms of different types. So, we have two main ones I want you guys to take note of. It's either acute inflammation or chronic inflammation. Why is that important? Now, acute inflammation, obviously short duration, happens pretty quickly, and it is kind of a good thing because this is where we get scabs built up after we have a scratch or a cut. So basically it's our body's way of initially fighting whatever it is that's causing the inflammation. Now, on the other hand, chronic inflammation, which is that long-term one, the one that goes from weeks to months to years. This is the one that is a slower onset in development and usually leads to a lot of breakdown in the actual system. So I kind of wanted to put this slide together so that people can see the difference between the two and to basically note that not all inflammation is bad. You do need some level of inflammation in your body to help with healing and to activate those cells to help fight off any invaders that come into your system. So it's a good thing to have inflammation, but minimize it as much as possible. This slide is more for my science-backed people, background people, to know exactly what are the major cascades and factors that pushes inflammation. NF-kappa B, or nuclear factor kappa B. Now, this regulates multiple aspects of the innate and adaptive immune system and serves as a pivotal mediator of inflammatory responses. So NF-kappa beta induces the expression of various pro-inflammatory genes, including those encoding for different types of cytokines, chemokines, and all other participants in the inflammasome regulation. So, in addition to this, NF-kappa B also plays a critical role in the regulating the survival and activation of differentiated innate immune cells and inflammatory T cells. So consequently, this deregulated NF-kappa beta activation contributes to the pathogenic process of various inflammatory diseases. So this is my quick slide and just kind of showing you guys what we're dealing with when we as physicians are trying to fight and limit inflammation. It all goes back to the cell. It was a bit busy. I know it's a lot of science, but I like to start from somewhere because this is going to show you how these particular 10 foods that we talk about later on in the slideshow can help to lower inflammation. First one is turmeric. So turmeric, its active ingredient is actually called curcumin, and this one inhibits that NF-kappa beta we just talked about, which is the molecule that's pivotal in setting off a lot of these inflammatory reactions in the body. So turmeric is a good one. You can get it in supplement form, or you can find it in certain ethnic foods like Indian food, but it's a good one to have as part. If you have it in your pantry, you definitely want to use it to help with lowering inflammation. Ginger, who doesn't love a good ginger drink, right? Whether it's ginger ale or even just a raw ginger, which you can grind into tea. Active compounds in ginger are called gingerols and shogols and paradols, which are the main polyphenols in fresh ginger. So what these do is they actually block TNF-alpha, IL-6 and IL-17, which are also pro-inflammatory cytokines in the body. Now, some of us may know TNF-alpha because it is also the mediator that's blocked by certain drugs that we use to treat diseases like psoriatic arthritis, lupus, and rheumatoid arthritis. So use ginger to help with lowering inflammation. Garlic, pretty important spice. The active compound in it is called allicin, and there are other sulfur compounds as well which help to lower inflammation by blocking, once again, TNF-alpha and interleukin 1. Cinnamon. So cinnamon has what we call cinnamaldehyde. Now, cinnamaldehyde reduces inflammation by blocking the release of arachidonic acid. Now, when you think of arachidonic acid, it's basically that acid in the pathway of the COX-2, which is, as you can see, lower down here. Now, COX-2, if you think of drugs like Celebrex, meloxicam, those are COX-2 inhibitors. So those block that pathway as well. So you can potentially use cinnamon to help with blocking that inflammatory pathway or cascade. And we use cinnamon also for patients who have diabetes because it does help with reducing inflammation and modulating and keeping your sugar at good levels. Green tea. Now, green tea doesn't necessarily block inflammation through the pathways you mentioned before, but what it is, it has a good bit of antioxidant activity. So the active compound in green tea is called a catechin, and the most common one is EGCG. Now this blocks the pro-inflammatory substances by the antioxidant mechanism. Now, just the antioxidants, these are compounds that protect the cells against damaging effects of reactive oxygen species or free radicals, as we call them. All right. Some examples are like superoxide, just to get a little technical. So when you have an imbalance between the antioxidants and the reactive oxygen species, this causes oxidative stress, leads to cell damage and disease formation. So you want to make sure you keep the antioxidants active and you eat foods that are rich in antioxidant activity. Just like berries. So berries like blueberries, strawberries, raspberries, these ones are ones rich in antioxidants called anthocyanins, and these help to reduce inflammation by the mechanism we mentioned earlier by blocking pro-inflammatory cytokines. Olive oil. Commonly used in my house. Types are extra virgin or virgin olive oil. It has what we call oleic acid, which has antioxidant effects, which, as we know, helps to lower inflammation. The main phenolic includes one called hydroxytyrosol, and this is the one that's the main one that helps to lower inflammation through antioxidant activity. Tomatoes. Rich in lycopene, and lycopene is the antioxidant in tomatoes, and it's a natural one that can help combat different types of cancer. It's actually been shown in a few studies to help with reduction in prostate cancer, and some studies have suggested it may play a role in helping with reducing breast, lung, stomach, colorectal, oral, esophageal, even pancreatic and bladder cancer as well. But obviously more studies are needed to show its true efficacy in those particular disease processes. So the antioxidants present in tomato can delay, hinder, and even prevent free radical oxidation, thus forming stable radicals, which you want to see. Dark chocolate, a favorite around my house and also around Valentine's Day, birthdays, you name it. Dark chocolate's good. So it is great for health. It has flavonoids, which reduce inflammation, and the main antioxidant phytonutrient present in cocoa bean are polyphenols and flavonoids, like I mentioned. 10% of the dry weight of cocoa bean is composed of polyphenols. The most abundant flavonoid in cocoa powder is called a catechin. Also, they have anthocyanins and proanthocyanins. So just like we saw before, these are good anti-inflammatory polyphenols or substances to help reduction in inflammation by blocking those pro-inflammatory cytokines. Nuts. Who doesn't love a good nut, right? Almonds, walnuts, cashews, those are some examples, and these also are rich in fats, fiber, and antioxidants like vitamin E, which ultimately help to reduce inflammation, and they are a good source of monounsaturated and polyunsaturated fats, good source of vitamin E and K, minerals like magnesium, copper, potassium, and selenium. The nuts are rich in all of these, and it's good to have a healthy amount of nuts in your diet, especially if you're not allergic. So just be very careful. So in conclusion, we want you to kind of keep your diet varied. And based on what I have spoken about today, look in your pantry, look in your fridge. If you have some of these foods, make sure your diet is rich in these foods, because we want to help reduce inflammation on a more larger scale as opposed to using medications that you buy over the counter. So try to eat healthy to stay healthy. Here are some of the references from my talk. This is where I researched and was able to gather some of the information that I put in the study, in this actual presentation. And I hope you guys benefit from it, and I hope you guys enjoyed. And eat healthy to stay healthy. And as we always like you to do, live life better with us here at AMG. Take care.